being able to apply information in different ways, in different contexts, particularly as new information becomes available, new data, new assumptions, and being able to operate in an agile way, I think will be more important.
I'm Dr. Louise Messara, and this is the Future Health Podcast. We're constantly being bombarded with the suggestion that what it means to work in healthcare is on the precipice of total transformation, and that technology and AI is set to revolutionise everything. Sure, some of the jobs we do today will be redundant, some jobs will need entirely new skill sets, and some jobs are yet to even be defined. And this might mean a change in how we train and even the sorts of people who decide on a career in healthcare. But how do we know which jobs are going to be less necessary and which jobs are going to emerge? In Singapore, the government has created a skills portal which maps how jobs across all industries will change on a 2-year horizon. It provides guidance on the skills that are needed to be future ready and gives every citizen credit to spend on relevant skills training, which is a pretty powerful nudge if your intent is to foster a culture of lifelong learning. We don't have a health jobs portal just yet, but we do have today's guest, Kirsty Hosea, to guide us as we tackle questions about how our jobs may change in the next few years and what skills staff will need to be armed with to thrive in the healthcare sector into the future. Kirsty Hosea is a partner in EY's people consulting practice. She's passionate about the people side of transformation, and she has experience in the health sector in both the US and Australia, where she focuses on workforce challenges and digital transformation, making her the perfect person to help us tackle today's topic. So Kirsty, what do we already know today about what some of the likely changes will be for health jobs in the next decade?
Yeah, in the next decade, there's just no question that digital is going to be front and center. And as we see more people embracing data and being able to interpret that to make better clinical decisions, it's really going to change the way that we operate.
One of the elements of a changing workforce at the moment is this sort of different approach to flexibility, adaptability. I'm wondering in an institution like health, which can be slow changing,
yes,
how you think we're going to handle some of the sort of remaining relevant in the employer sort of market. Can we keep up pace with the expectations of the new workforce?
Yeah, it's a challenge because it is a very regimented discipline, isn't it? In
it's hard
health.
to work from home, isn't
it?
Yeah,
it is. But actually what we're seeing now is that but younger generations that are coming into the sector are valuing that workforce flexibility a lot more than what we've seen in the past. They're not willing to work the long hours anymore. They want to be able to work where they want, when they want. And so that's going to place quite a strong strain, I think, in how we think about workforce today. What are those skills and capabilities that are required? And will they be more niche, perhaps, so that allowing them to work in shift requirements in different directions.
Are we going to end up with a sort of a gig economy in health?
I think there'll be some of that, to be fair. We're already seeing it with some organizations like ShiftMed, and if you've heard of that organization before, it's like a Uber for health practitioners, and they're supplementing or creating their schedules around how they want to work and how many hours more and above. Places less strain in the existing workforce and limits the need for overtime. You can see where that flexibility, more and more people are wanting that, and it's a way to reduce burnout. So it's possible.
Is there data on skills or skill sets that sort of most likely help workers to remain relevant in this changing time?
Yeah, I think we certainly, with the adaptability requirements and collaboration, those sort of skills, those we say softer skills, but actually they're the hard ones, right? Harder skills,
yeah.
Absolutely. Being able to apply information in different ways, in different contexts, particularly as new information becomes available, new data, new assumptions and such, and being able to operate in an agile way, I think will be more important, as well as that collaboration as you're dealing more with healthcare teams and particularly in a virtual environment.
It's going to be interesting how we train and educate in this space when we're talking about the harder, softer skills. I just wonder whether the 5 and 6 year degrees are going to sort of cut the mustard in terms of what we really want our health professionals to hit the floor running with in terms of the skill set that they bring.
Yeah, I think it is interesting, and now you're seeing more and more universities requiring longer or more exposure in the workplace before they finish their degree, and even virtual hospitals and virtual hospital learning environments where students can be doing simulations of what is it like to work with actual data in a hospital, either to manage operations or engage with patients, where they can put them in scenarios where they can test that adaptability and crisis management and pressure systems is what they do today.
I mean, it's interesting. I wonder whether, as one of the specializations of medicine moving forward, whether that virtual care is going to sort of become its own college and its own division of healthcare. I wonder whether the specific skills that you need to bring to that sort of delivery of care environment are different enough.
Certainly those skills in a virtual environment are different from what they would be in a traditional face-to-face setting, where you can pick up on a number of different cues to be engaged with patient. Now where you're looking at data and underlying information, and you're making hypotheses with many different variables, as well as having to understand the nature of what people might be like in their own home. So different kind of exposure, and in fact, probably more stimuli than you would get if you were treating somebody in a hospital room.
There's been a long tension in healthcare between this sort of idea of we need to become more and more specialised, or particularly in Australia, we need to remain really generalised. Do you have a view as to which direction we're going to head over the next sort of 20 years?
Yeah, the research is really showing that people are going to become deeper experts in a domain, and that's why those clinical health teams become really important. And AI and generative AI will help us to learn deeper and faster about those skills and disciplines. But I personally believe that it's going to be more specialized.
So do you think there's going to be a shift in emphasis in terms of sort of knowledge to capability? I just, I wonder when we can Dr. Google almost everything, whether the knowledge piece of health is becoming less important.
Oh, I think that's always going to be important. At the end of the day, we are talking about life or death situations. But I do think the ability to think critically, to be able to analyze and think about also areas of governance, because as you think about the information that's being presented to you, organizations and hospitals need to be assured that that information's correct, that it's not been fed bad information into the systems. You have to be able to still question what you're seeing and reading. So that skill for the clinician to be able to make decisions is still critically important. That doesn't go away, but we might be able to prompt and predict and provide options a little bit faster than what we have in the past.
Do you think that's going to change the way we select who our future healthcare workers are?
I think it will. I definitely think it will, but not only just for those reasons, but also as we think about the profile and demographics of our population moving forward. We're looking at cultural diversity much more than we have before. People make decisions, whether it's purchasing decisions or health decisions, largely emotionally. So understanding behaviors and how that influences decisions. Lots of different human capabilities.
Yeah, I mean, that idea of sort of nudge is...
That's exactly right.
Yeah.
Yes.
I wonder whether we're going to become, as doctors, sort of communicators and behavioural insights experts, almost more than anything else.
I think so. I think that could definitely be heading in that direction. You see it now in apps like MyFitnessPal.
Yeah.
When you're recording your daily activity, your daily food, etc. And at the end of the day, it gives you a prompt. If you continue eating the way you did today, and in 6 weeks' time, you would have lost or gained X amount. But let's say, for example, that we've got a good understanding of what my background is. So I'm a mother of 2 children. My daughter may choose to get married in, let's say, 5 or 6 years. What if I had a chronic condition, if I was suffering from diabetes, but I wasn't really managing my health as I should? Then what you could get, to your point about the prompts and such, you get then that storytelling. It's like, Kirsty, do you want to be able to be in a position to be at Sarah's wedding, to be able to have that special moments and physical activities that are really milestone driven? So you can get much more personalized in terms of making that connection that would potentially drive behaviors in the right direction.
I think when I was going through university medical school, it was very academic driven. You just had to get this mark and off you went. I do wonder about the benefit of a much broader approach to the analysis of the skills as part of a team we would need to bring in. And I just wonder whether we're going to get as clever with that part of it, because it feels like we're, all these elements of how we deliver healthcare are exponentially improving, but we're sort of stuck a little bit in tradition in terms of how we enter people into the journey. I just wonder whether that entry point has to be as advanced and sophisticated and nuanced as the rest of health is looking to become.
I think to have a baseline level across those disciplines, whether it's those softer skills, those behavioral curiosity and analytical skills, much like you do your foundation courses, you'd be looking for that. But then I think there'd be tracks that you go and dive deeper into, whether that is an analytical profile, whether that is a behavioral, insight-driven profile, or whether it is the care model with somebody people that have a preference to be more hands-on care and empathetic in that direction.
Do you think the shift towards sort of more preventative rather than a reactive health system feels like it's going to mean a shift in where people are doing their work?
Yes.
The majority of the workforce now, we feel like the majority of the workforce is in the hospital, but maybe that's not even true today. But how do you see where we do our work changing over the next 10 years?
Yeah, I think there will be a lot more flexibility, and particularly when you're looking at remote care. And telehealth, etc., and the complexities of what you need to interact with and the tools that you need to interact with there. But community-based care, being more in the field, at home monitoring and visits and such. So you get back to those doctor visits in the home.
Yeah, isn't it funny? It's Back to the Future, isn't it?
It's a little bit.
Yeah.
Yes, exactly. So now people have been conditioned to be going to their GP, to going to the hospitals for things other than acute care. And that just, quite frankly, the system can't handle it, and it does need to change.
So, we have an issue with an ageing population and a shortage of workforce in general, but we also have an ageing workforce in health.
Yes.
And the interplay of that is all quite interesting. We need to encourage our workforce to remain active for as long as is good. Do you think we need some new strategies, some new flexibility in healthcare to allow for that? We can't have probably 75-year-old nurses on the floor for 12 hours doing night shifts, but we need their expertise. How can we do this?
Yeah, and it is a serious problem. In fact, they're predicting a nurse shortage of 123,000 by 2030. And for GPs as well, it is being much as just over 10,600.
Yeah, I think I read yesterday we've moved from a 1 in 2 medical graduates going to GP to 1 in 7. So that's a big change, a big transition for the system to handle.
Yes, absolutely. So I think we really need to be thinking about how are we operating to the best or the top of our qualification and our physical ability, as well as with all these tools that are at our disposal, whether they are physical in person or whether they're virtual. And then what I mentioned earlier about shift med, not that is the right solution, but I think we really need to be thinking carefully about, do we need somebody on for a 12-hour shift or an 8-hour shift? Could 2 or 3 hours be sufficient, perhaps for some of those generational concerns that you mentioned, that can still get some of the critical jobs done and transfer knowledge as well?
We talked about people working at the top of their scope of practice, if you like. Do we also need to be prepared to start talking about a shift in roles? And I know there's lots of controversy around nurse anaesthetists, nurses doing endoscopic work, for example. Is it time, with the shortage that you've just sort of identified as coming, do we really need to sit down and have that conversation around a shift from roles to skills, maybe?
Yes, what worked yesterday is definitely not going to work today or even in the future. So we have to be having a real strategic analysis of what are the jobs of today and the future. And what's interesting is in a research that we did around a global health study, and what we found is that many organizations, only about 63% are actually well informed of what the skills of the future are. So you see a lot of people that have a lot of organizations that are investing in technology. There's no question that's built into their strategy. But at the same time, they're not asking the questions of, yes, we're implementing the technology, but what does that mean for the workforce? What does that mean for the skills that are going to be needed? And when will they be needed? When will it be operationalized at scale to be able to shift our capability requirements?
I mean, that's so important, isn't it? Because if we don't know the skills that our workforce are really going to need, it's very hard to prepare, whether that's at a university or tertiary level, or even the way we choose to invest in our training and development budgets. We're putting a lot of money into training and development. But again, you'd have to ask the question, if we don't know the answer to the first question, how do we know where to most strategically put our budget?
Yes, that's right. A lot of organizations are just focused on how are we able to deliver today. And while the intent there is to think about the strategic long view, sometimes that can be a difficult focal point when you're just trying to keep patients safe.
Look, 100%. And I suppose we need to, there's the people that are dealing with the urgent, but there does need to be a strain of people dealing with the important, which is this preparatory work.
Yes.
I wanted to touch on, there's a lot of fear in health around the impact of AI. And I mean, I think you mentioned right at the top end, there are lots of elements of people's roles that may be able to be mechanized, or, technology will, and that's true and has to happen. And I think we need to move into a mindset of what does that free us as people in health to do.
Yes.
I don't think it means we're not going to have jobs. I think we'll just have slightly different jobs, and that could be exciting, and that could mean a lot more of the meaningful part of our work coming to the fore.
Yeah.
But I'm interested in what, if AI isn't going to be replacing jobs, what you think it's going to offer the workforce. I
think it enables, yes, it does free up a lot of administrative time, and it helps to make better decisions as we're driving through. The danger that we sometimes fall into is that when we're deploying these automation and AI technologies, it does free up as much as 30-40% in a person's workload, even for helping them find things around the hospital that can consume time. But the danger really is making sure that we're not just overloading that with more patients that are coming in. We have to create the space that, and in the recent Global Voices of Health study that we did back in October, we found that was the number one concern for clinical staff, is that they don't have enough time or autonomy to be able to see their patients and be able to safely care for them. So as you're talking about what is AI doing? Yes, it's creating that ability to operate faster with more confidence, to be able to see themes and patterns, so that you can spend more time perhaps with those patients to ensure that they're implementing the behaviors that they need.
I remember reading about and this is very ad hoc, I haven't got any of the details in front of me, but where the times nurses were spending from the station to the bedside to respond to requests for things like a glass of water or a pillow or a blanket. It was a very disproportionate part of the day. And so, I mean, that's a very simple example of how a button at the bedside that goes straight to health services, who will bring whatever is required to bring and leave the nurses out of that entirely, is an opportunity for nurses to actually come and ask important questions at the bedside or spend time with family explaining the situation. I think that's all correct. It's interesting that you say the fear is that we'll give them more time, but we'll give them more patience.
Yes. Unless there is a stronger focus in that preventative care as well. Because if we don't, we've got to find a way to be able to stop the flow, to be able to direct patients to the right channel for them to be seen. We
have a finite pool. Do you think anyone's come up with a strategy for how we can best allocate that pool?
Oh, I still think that's a question to be solved, isn't it? But in terms of just really understanding, how fast is this technology going to be implemented? There's been all kinds of conversations around how can you use other members of the workforce, whether that's paramedics in rural locations and others. It's no one solution. I think it's a mix that you need to be drawing on. But then also, do we have enough people? Do we need to focus more on our immigration policy to bring more people in? there's so much that that technology can do in a remote instance, but still some people will need that face-to-face care.
I referenced the Singapore government approach to sort of skill knowledge, if you like, in the introduction. And I wonder what your reflections are on that particular strategy as a way in which we can get a handle on where we're heading, and as an employer or as an employee, really being able to identify what training needs to be undertaken or what training I need to do.
Yeah.
I mean, it seemed to me like a good starting point, and I wonder what your thoughts are about that.
Yeah, the Skills Future program in Singapore is fantastic, and it's really looking at that 2-year horizon of, if I have a certain job today and I key in my job, what skills will I need in 2 years' time. I think the nuance there with the Singaporean government is a very tight linkage between government, industry, and educators, and to build that talent. So there's constant...
We're a bit more fragmented here.
Yes,
Right.
sadly so. But, with them working closely together, there's a common understanding of what that is. And there's a common understanding of where technology is going to go, and how people will be interacting with that. When you think about, our environment at the moment, to your point of, we don't necessarily know exactly... We have an idea of what those skills are going to be. We don't know when they're going to become scalable, so that it's going to be broad reaching. We really need to be looking at, and whether it's done by a hospital basis or a system basis, of what are the skills that we have today? What are the skills that we believe, based on our technology investments, when that roadmap is going to land? Then what are the skills of the future? And constantly be looking ahead, and then creating skills pathways, because people become very overwhelmed, in particularly in a clinical setting where there's already that feeling of burnout. How do you make sure that you really embed, as the Singaporean government did, this lifelong learning concept, and creating space for people to actually learn as they drive along? But those pathways are really important so that people can see and have direct actions on what they need to do to get there.
Well, that sort of takes us to that nudge question. I mean, it's the Singaporean government giving the $500 to each person.
Yes.
That's a nudge.
Yes.
In that sort of lifelong learning culture direction. So, but if we were to look at a similar sort of project for, say, New South Wales Health, 2 years seems like a very tight horizon. Do you think in health we need to be stretching that out a bit?
I think in New South Wales Health, there's now moving to the single digital patient record.
Yeah.
That's a certainty. That's not a will it, won't it. It's happening. So I think in terms of what the skill sets that will require now, of really understanding how to interpret the data that comes through those records, how to be interrelating and collaborating in new and different ways, I think there are things that we should be focusing on now.
In the work that you're doing and the work that you're looking at, are you seeing that the education sector is coming along on this ride as well, or is it something that employers and governments are going to sort of tuck them in the back end? Unless we're all working collaboratively, it's going to be a real challenge.
Yeah, I think they are, definitely. There's a number of degree options now, from undergraduate all the way through to, a doctorate, that's looking at health informatics and how that can be applied. I think the tertiary sector is looking a lot more at micro skills, and how can we deliver information just in time or in short consumable packages, which I think keeps things much more relevant as we drive along. And you think of now when a student studies computer engineering at the beginning of their degree, they're saying by 3 years' time, a lot of that content's obsolete. So I think what universities are delivering and how they're delivering will continue to evolve.
If we think a little bit about just some of the global trends in the health workforce, yes, it's getting older, but we're also seeing a lot of people leave in mid-career. This is sort of a new, you used to be in health and it was a career for life. What are your thoughts around that sort of drift in mid-career?
Yeah, well, there's a couple of different nuances, I think. And when you think about mid-career, it's at an interesting time where people many women, and we know that there's more women now than there are men that are in the health sector and the clinical settings. But when you get to those specializations, are right in the time where you get to your, the time of life where you want to be having your family. And so there's a lot of restrictions sometimes on how you can complete your specialization at particular points in time. And that's one barrier in itself. I think also the burnout is real, and now people are seeing as well that there are alternative options than being on the wards and in that face-to-face delivery mode, where we're seeing a lot of people show more interest also in health informatics. So you can have a better work-life balance and being able to manage and control your hours a little bit more. And then there is also that concern that I mentioned a little earlier about the lack of autonomy and legitimate concern that individuals may carry that they're not providing the best care that they could possibly do. And that is a ethical rub, I think, for some people.
Do you have advice for the health sector? Do you have advice around how we can return to being, a top employer of choice for people at all stages of their career?
Yeah, well, many people obviously go into the sector because they have that high degree of empathy and want to be with people. So how can you help people to and help clinicians to be able to deliver at the top of their scope? That would be one thing. And eliminating a lot of the administrative burden. So that's where a lot of hospitals can be looking at how can we use the automation, AI and such, but then also preparing the workforce at the same time for what that means. So quite often you see that a new system will be implemented or a new process, but it'll drop, you'll get trained on the system, but not necessarily how to think and work in different ways to be able to really generate the benefit of that. So another area is also helping the organization and helping the people to understand what are those pathways, what are the different options that you could move into, so you don't feel like all of a sudden you've been in, sort of the same career in the same direction for periods of time as it has in the past, but you actually have points of engagement where you can pivot and specialize in different ways and areas, being transparent about what that looks like, and as well as those skills pathways that we talked about to help people, improve upon their qualifications.
So if we had a portal where we could just plug in our job and it told us the skills and therefore the training pathways that we needed to fulfill, obviously that would give me some comfort as a trainee or as a professional, but surely it's going to help organisations when they think about the distribution of their learning and development funds. We hear a lot about perhaps the misdistribution of funds. How do you see those two pieces sort of coming together?
Yeah, great question. Today, organisations across the board are spending about $12 billion on learning and development. And much of that content is really focused on compliance and skills of today. But about 4 billion of that could actually be reapplied into skills of the future. So I think that there's a large amount of money that could be repurposed to build these future skills, as well as the halo effect of that is improving people's passion for what they're doing at work, for their engagement and their futures.
Kirsty, there are a lot of unanswered questions, and we do have to get to the bottom of some of these soon so that we're prepared in 10, 20 and 30 years. But thank you very much for your insights today, and I appreciate all your time being with us.
Oh, it's my pleasure. Thank you.